Greetings, acugynecology patients, endo warriors, and acupuncture friends. Today I wanted to chat a little bit about acupuncture and fertility. So this isn't just for those who experience fertility challenges because of endometriosis, whether you are single, gay, straight, a couple, or plus. There are many other conditions that can interfere with fertility and create challenges that acupuncture can help with. As someone who went through fertility treatments and used acupuncture, I can share some of the wisdom and experience as both a patient and as a practitioner. Those going through fertility concerns are generally voracious readers, reading up on any and every change they can make to increase their odds of having a baby. This was definitely me. I am in that category. I am there with you, and I know what that's like. I had already been receiving regular acupuncture treatments when fertility challenges reared their head in my life. I increased the frequency of treatment when I started to realize that there were challenges. I wasn't yet an acupuncturist, but I was in acupuncture school at the time. So I was going through school and I knew what I should be doing in terms of alternative treatments that could help or complementary treatments. Back when I went through this, a study came out that indicated that when acupuncture was administered before and after an embryo transfer, that it increased the chances of a successful IVF cycle. My twins at the time of recording this are 17, so this is going back 17 years ago that the study was published. It's called the Paulus Protocol, and it is still used in studies that are done now as the foundation for creating new studies. There are subsequent studies that have been published that both support and don't support the protocol, but it is still used. I still use it in my practice. But I want to talk about when acupuncturists come into the picture, there is a bigger way that we can help than just doing acupuncture right before and after an embryo transfer. What most acupuncturists will agree on, and I think you'd be hard-pressed to find someone who would say differently, is that getting acupuncture prior to an embryo transfer and even prior to trying to conceive is more important than on just the day of an embryo transfer. Getting treatments in the months before an egg retrieval or an IUI, or just if you're trying to conceive in general, is beneficial. I myself, as well as many other colleagues, like to see a patient for at least 3 months before they're trying to conceive, just because stress in our lives impacts what we do in one way or another. And in some cases, if I'm treating a couple, both of them will come in to reduce the stress. So why prior to the embryo transfer? Acupuncture can improve egg quality as well as sperm quality. The you that is you comes from your parent's health at the time of conception. As a potential parent, the idea would be that you would want your health to be in as optimal a state as possible prior to conception. So as an example, if there's a potential parent that's smoking, what we call the prenatal chi, the chi that you're born with, the chi that's being given to the baby, is not going to be the same as the chi that comes from parents who are not smoking. My mentor always likes to use the analogy of it's like coins in a bank account. So baby A is born to parents who eat well, they don't smoke, they're getting the best food, they don't eat fast food, they're exercising all the time, and then this baby is born with 1,000 coins in the bank account. So 1,000 coins is an arbitrary number. We don't specifically know, there's no way of measuring it, but ideally, let's say this baby has 1,000 coins. And then you have baby B, whose parents maybe smoke and they're drinkers and they're eating fast food all the time. They maybe never exercise at all, or they exercise once in a while. So this baby is born with 100 coins in their bank account. So you also have postnatal chi, which is the energy that you can replace through food, exercise, and healthy living. So those prenatal coins are all that you're going to get. What you're born with, you're born with. And you want to try and use your postnatal chi so that you never dip into that account. But if you're starting out with less of them, of those coins are even more critical to your health to not use. So we want to give your baby as many coins as possible. So things that acupuncture can help with if the menstrual cycle is irregular, usually within 3 months it regulates if the treatment is consistent. So if your acupuncturist, me for example, tells you you need to be seen 2 times a week for 4 to 6 weeks and then we'll reassess, or 4 to 8 weeks because we want to see what 2 cycles are like, and you come in 1 week and you skip the next week and then maybe you do 2 treatments, you might not see the results you want. We might not see changes in the cycle. And some patients have issues that take longer to resolve. If a patient has no menstrual cycle at all, depending on why that is, it could take 6 months or more because the first 6 months might be working towards just getting a menstrual cycle going again. And, different things come into play. I sometimes do herbs with patients. Sometimes I do moxibustion, which is mugwort compacted and burned over points. Some Western doctors prefer that you not take herbs. In most cases, the herbal formulas will help you to achieve the desired results in a shorter period of time. So maybe you don't want to do herbs, but we'll make food suggestions that you should add into your diet. I find that receiving acupuncture while undergoing IUIs and IVF treatments usually minimizes the side effects of the drugs that are administered to, say, stimulate follicle production, the trigger shots. They tend to make people cranky. I've had some people say even angry if they'll admit to it. So the fertility drugs are meant to control the cycles, which is necessary. Every detail has to be fine-tuned. But I've found that when patients are undergoing this, if they miss a treatment, their loved ones will say, "Did you miss a treatment with Dr. Stephanie? Because you are very cranky." Those meds are intense. So that alone might be a reason to get in and see an acupuncturist while you're undergoing fertility treatments, to minimize that stress that goes along with it so that your coworkers don't want to come over and wring your neck at some point because they're like, what the heck is going on? These treatments, the fertility treatments, not the acupuncture treatments, push your body into extreme states. You're stimulating a lot of follicles, and acupuncture works to bring about balance in those situations so that the body recovers quicker from being hyperstimulated. So it's not working against it. It's not going to stop the drugs from producing more follicles, but it smooths things out and makes what's going on more tolerable for most patients. So this is not an extensive explanation of what goes on with acupuncture, as I just wanted to give a glimpse and explain why when patients call us acupuncturists and they just want to do, "I'm getting an embryo transfer tomorrow and can you do before and after because I read on the internet that helps." It's not that we don't want to, it's that what you could have done in the months before would be more beneficial than just doing before and after the embryo transfer. I like seeing someone through the process and then doing on the day of the transfer just to sort of secure it. And I also like to do 2 days later. And a lot of my patients continue with it in the months after to help with morning sickness, if there's somebody who has headaches and the headaches don't resolve while they're pregnant or didn't fully resolve before they did IVF or IUI. They continue with their treatments so that the stress level is lower and they're overall healthier for the baby. Patients who continue with treatments tend to, right before they're going to give birth, increase the number of treatments, and the births seem to go smoothly. They dilate better. They need less meds when they're going through it. They maybe just need a little bit of a muscle relaxer and they don't feel like they need to have an epidural. If they do have an epidural, they still feel like their labor progresses better. But overall, it is far better to see one of us prior to trying to conceive, whether or not you think you may have fertility issues, and get on the bandwagon and get treated regularly. So stop back again. We'll talk more things endometriosis and health. Make sure that you're subscribed so that you get notified automatically when we drop a new video in. Also visit our Instagram account at Natural Alternatives Center, and I will post links below. Facebook is Natural Alternatives Center for Wellness, and our website is www.naturalalternativescenterforwellness.com. I hope to see you back here, and I look forward to sharing more health tips with you. Be well. Have a great day.